We're presenting data from a group of diabetes patients who were followed up over a year, looking at whether their sleep habit affects their obesity and diabetes control in terms of sensitivity to their insulin over time. Well, we had sleep diaries, and we asked them every day to write on what time they went to bed and what time they woke up and how much sleep they were having, and also during weekends. And by comparing sleep during the weekday and the weekend, we're able to calculate the sleep debt. Previous large population studies have shown there's an association between shorter sleep duration, obesity and diabetes. Now, they've looked at extremes of short sleep duration, and none have looked at over time where the sleep loss accumulates. So in our group of 522 patients with early diabetes, we're able to ask them the question, how much sleep do you get every night, and to see over the week how much sleep debt or accumulated sleep loss they have over time. What we found was remarkable in that as we followed them up over 6 months and 12 months, that the ones who had a greater sleep debt ended up having greater obesity and less sensitivity to the insulin that they were producing over 6 months and 12 months. But what's so interesting is the loss of sleep debt of about 30 minutes a day was equivalent to increased risk of developing obesity and diabetes later on. Now, this is quite interesting because we know from sleep deprivation studies, if you bring volunteers and you sleep deprive them, their cognitive function gets worse the more you sleep deprive them over time. So this is the first time we've actually observed that actually the same occurs with metabolism. Well, we know that a lot of lifestyle interventions for diabetes don't necessarily succeed in the long term. One of the reasons could be we're looking at diet and we're looking at physical activity, but we're looking at the third lifestyle factor, which is sleep. And if we included sleep into those interventions, we're going to get better outcomes. Everybody needs sleep. It's a very conserved biological activity from very basic organisms to human beings. So therefore, incorporating good sleep into our habits is likely to be beneficial for many different functions. The idea is not to prescribe a particular length of sleep. Every individual has a different length of sleep, but to optimize sleep. And to optimize sleep, there are many things that we can do to ensure that we have regular bedtimes and wake times as much as we can, avoid caffeinated drinks near bedtime. Extreme exercise near bedtime also disturbs sleep. Alcohol disturbs sleep as well. And also sleeping in a dark, sort of cold type of room also allows you to sleep better rather than being in a hot room. So there's a lot of things that we can do to optimize our sleep. The idea is not to sleep more, but to make sure that we get the best sleep that we can, that we physiologically need.